Hi, this is Dr. Ben. Today we're playing 20 questions with 3 tinnitus experts from Treble Health, Dr. Tracy, Dr. Suzanne, and Dr. Michelle. Let's get started with question one. Question one, do you have tinnitus? If so, how do you manage it?
I don't currently have tinnitus, but I have had it before, and I manage it mostly with sound therapy and self-cognitive behavioral therapy.
I currently have tinnitus and I have had tinnitus for a while, and I manage it by doing sound therapy and holistic approaches.
I've also had tinnitus in the past, and I use sound therapy and cognitive behavioral techniques to help me with my tinnitus.
I have low-level tinnitus and doesn't affect me too much. I manage it by using sound therapy. Name one common cause of tinnitus.
Hearing loss.
Head injury.
Stress.
Medication changes. Where is the worst place to go if you have tinnitus?
Sitting in a silent room.
Wearing noise canceling headphones.
I was also going to say somewhere quiet.
I'm going to say a loud rock and roll 3-day festival without earplugs. Name one type of sound therapy device.
Hearing aids.
Sound generators like a speaker.
Bone conduction, hearing devices.
And ear level sound generators that don't have amplification. Name something that can spike tinnitus.
Stress.
Lack of sleep.
Loud noise.
Let's say negative counseling from a doctor telling you there's nothing you can do. All right, next, name one type of promising tinnitus research.
Odo 313.
FXR 322.
Oxytocin nasal spray.
Okay, Susan Shore's research out of Michigan, bimodal stimulation. Name one tinnitus treatment that has appeared promising but has since failed.
The Sound Cure device by Serenade.
I would say using ototoxic intratympanic steroid shots.
I think along those lines, like hyperbaric chamber, it doesn't really work for most patients.
All right, I'm going to say a dysynchra. What's the most painful or obscure treatment one of your patients has tried for tinnitus?
Having their auditory nerve cut.
Having laser treatments done to their ear.
Okay, I'm going to say a stem cell in the ear where they cut this man's fat off of his stomach and they did something in his ear and it didn't change anything. I was kind of upset by that. All right, next up. What's the moment that you knew you wanted to specialize in tinnitus?
The first tinnitus support group I attended in grad school at UB.
Having tinnitus myself and wanting to help other people like me.
I think after working with a patient that really just needed someone to talk to and listen to them. And after that moment, I realized that this was something I wanted to do.
For me is when I took a tinnitus coursework in grad school and then had a patient drive 4 hours to see us in San Francisco for an appointment. Name one piece of horrible advice that doctors might say to a patient with tinnitus.
I had a doctor tell a patient to wear tighter shoes so that they would be focused more on their feet being uncomfortable and in pain than their tinnitus.
Wow.
Having a doctor tell you that nothing can be done.
I think having been being told just to ignore it and live your life.
The response that almost assuming that it should be easy to just forget about it and not think about it. Really bad advice. We're halfway through the 20 questions. We just completed the first 10. If you're not already, make sure to subscribe to our YouTube channel for information on tinnitus, causes, treatments, and solutions. Now let's continue on with the next 10 questions of 20 questions with tinnitus experts. All right, name one type of doctor that can potentially help tinnitus.
A physical therapist.
An audiologist.
An ENT.
A psychiatrist or a psychologist. Name a sound that commonly triggers hyperacusis sound sensitivity.
Like a plate dropping or like a pots clanging together. Things in the kitchen.
Paper crunching.
Dogs barking or their nails clinking and clacking on wood floors or tile floors.
Water running from your kitchen sink. All right. Name a test that someone with tinnitus might receive.
Otoacoustic emissions. Hopefully.
An MRI.
A hearing test.
What is left? A test for TMJ from a dentist. Okay. Does anyone in your family have tinnitus?
No.
No, I'm the only one.
No one has chronic tinnitus, but I've had family members who've had intermittent tinnitus.
My mom has tinnitus and she tells me a lot about it. It's relatively mild, but she talks a lot about it. She's also on our newsletter list and watches a lot of our YouTube videos. What is your go-to sound therapy for your patients?
a broadband noise, some version of broadband noise played through a variety of different transducers.
Ocean waves.
I just go broad nature sounds.
Pink noise. Everyone knows pink noise the best. What is your favorite relaxing sound in your life?
I mean, I like the ocean, like actually being by the ocean, living in the Bay Area. So natural ocean sound.
One of the sounds that I use to help with my tinnitus is frogs.
I really enjoy rainfall.
Rivers, being next to a river. If you could use only one of the methods we use to treat tinnitus in this hypothetical situation that you couldn't use both, which we know we always do at Treble Health, would you choose CBT-based therapy or sound therapy? If you could only choose one.
I would choose CBT-based therapy because I feel like there's more interactive sessions with patients. So a little bit more back and forth in a collaboration.
I like using sound therapy because that's what helped me the most.
I am also in agreement with Tracy. I like CBT, and I think if I had to choose only one, that's the route that I would go.
Yeah, if I had to choose only one, I would choose CBT as well, because there are some success stories who don't use sound therapy. So that's one thing to consider. But again, we recommend using both. How do you take care of your mental health? If at all.
I'm working on it. I don't know. I'll have to pass on that one. If anybody has some good advice here, I'll take it.
I take my dogs for a walk. Walking around is very helpful to me mentally.
I enjoy planning trips, and whether they actually manifest themselves or not, but the idea of like planning and traveling for me really relaxes me.
I'm going to say exercise and having conversations with friends and family, with loved ones. Okay, just two more questions here. What's something that could help tinnitus that you can buy on Amazon?
Musicians' earplugs, non-custom.
I'm going to say audiobooks.
Sound machines.
And I will say the Tinnitus Retraining Therapy book by Pal Jastreboff. Boom. Last question. What's the shortest amount of time you've worked with a patient to help them reach habituation?
Ooh, I think my record is 6 weeks, weekly sessions. I should say that.
2 months.
I think mine was also 5 weeks of weekly sessions.
Mine was 3 months, and I was so surprised about how quickly it went to near silence in 3 months. All right, we've done it. We've done the 20 questions with 4 doctors of audiology focused on tinnitus. This has never been done on the internet before. Thank you all for being here. Tracy, Suzanne, Michelle, thank you all for your expertise, your humor, and your time. If you enjoyed this, stick around for future games like this and leave us a comment below. What kind of questions would you like us to answer next time? See you all later.
Bye.
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 Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.